Welcome to the second video in our series, which will explore the AAA core service area of supportive services. The Older Americans Act requires that all area agencies on aging offer supportive services. That being said, this is a broad category that can encompass many types of programs and services. Services that typically fall into this category might include things like information and assistance programs, options counseling, transitional care programs that support patients discharging from the hospital, case management, homemaker or chore services, transportation, home modifications, or Medicare insurance counseling. Each agency on aging is different and will offer different services in this category. Therefore, even within the state of Washington, you will find AAAs who have more options for supportive services than others. We'll review some of the more commonly offered supportive services in the state. Historically, finding information on long-term services and supports has been a daunting task for people. Public long-term services and support systems vary by geographic location and contain multiple funding streams that are run by various agencies, so it can seem like a complicated maze at times. In the last decade, there has been a push to streamline access for long-term services and supports through what is called an Aging and Disability Resource Center, or an ADRC for short. ADRCs serve as single points of entry into the long-term services and support system for anyone in the community. ADRCs are tasked with raising visibility about the full range of options that are available to help support older adults and people with disabilities. ADRCs do not limit their services to a specific group, like low-income people. They help anyone, regardless of income or ability level. Older adults, people with disabilities, family caregivers, veterans, family members, community members, you name it. Anyone can use the ADRC for free to find reliable information and smooth entry into public services. Currently, nearly 3/4 of all AAAs across the country provide an Aging and Disability Resource Center. ADRCs really serve as a front door for services, meaning the ADRC is a single point of contact where community members can ask questions, access information and assistance services, obtain screenings for various programs, receive benefits counseling, and much more. ADRCs help address the frustrations that many people feel when they're trying to learn about long-term services and supports that are available. By using a person-centered options counseling approach, ADRCs help people get the help that they need by utilizing their resources more wisely. This can help prevent people from having to spend down their financial resources or face unnecessary placement in a care facility. People who use the ADRC can trust that they are receiving unbiased information. One of the great things about the ADRC is that the staff who work there do the problem solving and resource connection for the healthcare provider. They don't expect the healthcare provider to know exactly what specific programs their patients would qualify for. The ADRC staff will figure that part out for you. To refer a patient to an ADRC, you will need to provide the patient's name and contact information at an absolute minimum. It is also helpful for the ADRC to know the patient's date of birth, if there are any communication barriers, like if your patient is hard of hearing or does not speak English, and to know a little bit about why you're wanting to connect the patient with the ADRC. You don't need to provide their medical history, rather a simple explanation about what your patient is wanting help with. This is a case study of a patient who was referred to an ADRC and what happened as a result of his interaction with the ADRC. The patient is an 87-year-old male who came to the clinic for his annual wellness visit. The referral to the AAA indicated that the patient has been having trouble with balance, fell in the shower in the last month, and is having difficulty preparing meals. The doctor believes this patient needs a caregiver, but the patient is opposed to having anyone come into his home. Specialists from the ADRC spoke to the patient and learned that he does not have any safety equipment in his shower, and he cannot stand long enough to cook, so he's mostly been eating cereal. He was connected to the local equipment bank so he could get a shower chair, referred for a program to install shower safety equipment like grab bars, and referred to home-delivered meals. So as a result of his connection with the ADRC, we were able to meet him where he was, not having a person come into his home and provide caregiving services, but providing him with some basic services that will help support him in being independent at home. All AAAs in Washington and many across the country offer case management services. In Washington, case managers are responsible for assessing the patient's ADL and IADL needs. They work with the client to develop a plan of care for in-home services, then create an authorization for those needed services. Case managers are responsible for coordinating the services that their clients receive and work with their clients to provide advocacy and help in resolving issues that may arise. Case managers also check on their clients periodically to ensure the service plan continues to meet their needs. Depending on the program the client receives and the needs of the individual client, case managers may only speak with the client a few times per year or may have contact multiple times per month. During non-pandemic times, case managers go to their clients' homes at least once per year, sometimes more. Therefore, they have a unique understanding of the social determinants of health that might be affecting your patient. They see who's living in the home, how clean the home is, how the client is managing their medications, and safety concerns related to the environment. They may reach out to you with concerns regarding your patient. If a patient has a case manager, many providers find it helpful to list the case manager's contact information in the patient's medical record. This is a case study about a patient who was referred to the local AAA because he was needing more in-home care after his wife passed away. The patient is a 77-year-old male whose wife passed away last month. He uses a wheelchair to ambulate. He called his doctor's office and reported that he has been having a harder time managing his ADLs now that he no longer has the help of his wife. He says he has a lady who helps him twice a week, but he needs someone every day. Clinic staff discuss moving him to a higher level of care. He is adamant that he will never move to a nursing home, so the provider made a referral to the AAA. AAA staff identified that the patient has an existing case manager at the AAA who had not been notified that the patient's wife had passed. The case manager met with the patient to perform a new assessment of his current needs, resulting in him qualifying for an increase in caregiving hours. The case manager's assessment also triggered a referral to the AAA nurse because of possible skin concerns. The nurse identified a stage 1 pressure sore and coordinated with the primary care provider who was able to begin treatment in a timely manner. As you can see, AAA staff were able to identify that this referral was for one of their existing clients. The case manager of that patient was notified of the referral and was able to help remedy the situation, providing connection to services that ultimately coordinated with the healthcare team. Another supportive service that might be offered by the AAA is care coordination. Care coordination is an advocacy program for high-risk and high-cost Medicaid patients who have difficulty managing their healthcare goals on their own. Care coordinators provide one-on-one healthcare coaching to people who need a little bit of extra support. The program is focused on helping empower clients to manage their own health, connect the client and their family members to needed services, and help reduce unnecessary hospitalizations. Next, we'll hear about a case study about a patient who is a client of the AAA. It demonstrates how agency staff often work with the healthcare team to improve outcomes for shared patients. The patient is a 42-year-old male with schizophrenia and kidney failure. He struggles to keep his medications, appointments, and caregiver services organized. He has frequent hospitalizations due to medications being taken improperly. His Medicaid insurance provider referred him to the AAA. This patient qualified for the AAA's care coordination services. A care coordinator has been working with the patient to coordinate with his doctors and case manager to get a medication dispenser that's filled weekly by a nurse. The care coordinator implemented a system of communication with the care team and assisted in getting a new caregiver in the home that actually helps him track his appointments. This patient has not had any ER visits, hospital stays, or medication errors for 6 months, which is huge for this gentleman. As you can see, in-home care made a big difference in the life of this person. AAAs often provide in-home caregiving services as well. In Washington, there are multiple programs that offer in-home care to patients who need help with their ADLs, and they're all free or reduced cost. These programs have varying income and age requirements, but you don't need to memorize those requirements. The AAA staff will figure all of that out. Just know that the AAA is the right place to go to connect patients to in-home care. In-home care services help patients age in place by providing caregivers that work in the patient's home to help them with their ADL needs, including medication management, ambulation, transferring, toileting, eating, and bathing. In-home care is always tied to an ADL need, meaning that patients must need help with some of their ADLs in order to qualify to receive help with their IADLs, like housekeeping. The most widely used long-term care program in the state is the Medicaid Long-Term Care Program, which has been around for over 30 years. The official name of the Medicaid long-term care system is Community First Choice, but you might hear others refer to it as COPES. Now, we'll hear from a case manager to learn a little bit more about the Medicaid long-term care program. The patient is a 75-year-old with type 2 diabetes and amputation of their leg. The patient has had multiple falls while wearing the prosthetic leg and has been instructed to ambulate using a wheelchair. Severe neuropathy in their hands has caused the patient to get frequent burns on their fingers when they cooked, resulting in the amputation of some fingers over the last year. This patient was connected to the Medicaid Long-Term Care Program. They were assessed and approved for in-home care services with 87 hours of monthly care. The patient now has someone who can help them cook, provide transportation to medical appointments, and helps them with various ADLs like mobility tasks and personal hygiene.